Hi, my name's Hannah,
And I'm Emma.
and we are going to be presenting on sudden infant death syndrome. Before we get started, we wanted to clarify the breakdown of infant mortality. Infant mortality is the death of an infant before his or her first birthday. And infant mortality is then broken down into sudden unexpected infant death, which is a term used to describe the sudden and unexpected death of a baby less than 1 year old in which the cause was not obvious before investigation. The CDC then broke down sudden unexpected infant death syndrome into three categories. Those three categories are sudden infant death syndrome, accidental suffocation and strangulation in the bed, and unknown. Sudden infant death syndrome, also known as SIDS, is the unexpected death of an infant under the age of 1 year and the cause undetermined after a thorough investigation. The investigation includes a complete autopsy, an intense examination of the death scene, and a review of the family's clinical history. Like I said before, the CDC broke down the major causes of sudden unexpected infant death into three categories. And this is represented on this graph. And this is the breakdown of the sudden unexpected infant deaths in 2016. SIDS, which is represented in the orange, made up 42% of the 3,600 deaths in 2016, and this is equivalent to 1,500 SIDS deaths. And then the unknown causes, shown in green, made up 34%, or 1,200 deaths, and suffocation or strangulation, shown in purple, consisted of 24%, or 900 deaths. So there are infant risk factors for SIDS and maternal risk factors for SIDS. So referring to the infant risk factors, sex is a risk factor. So boys are more likely to die of SIDS than girls. Infants between the ages of 2 and 4 months are more likely and more vulnerable to SIDS. Race plays a factor as well, and we will go into that in a few slides. Family history is also a risk factor. So babies who have siblings or cousins who've died from SIDS are at a higher risk of SIDS. Secondhand smoke. Babies who live with smokers have a higher risk of SIDS. And premature birth. So babies who are born early and having low birth weights increases the baby's chance of SIDS, as well as the absence of a father. So infants who do not live with their fathers were 50% more likely to die of SIDS. And then the maternal risk factors were any mother that is younger than 20, their infant is more likely to develop SIDS. So if the mother smokes, or alcohol consumption or drug use, that increases the baby's chance of developing SIDS. And then inadequate prenatal care, short intervals during pregnancy, and then if a mother has more than one child, the chances of developing SIDS increases. Who is affected? So sudden unexpected infant deaths affect every ethnic group. There are certain races that are more at risk. The causes of sudden unexpected infant deaths are broken into three categories, as we previously mentioned. So this chart correlates with the previous slide. So orange will be SIDS, green is unknown, and purple is accidental suffocation. And the American Indian, Alaska Natives, and non-Hispanic blacks are the populations with the highest mortality rates for SIDS. Deaths due to SIDS accounted for the largest proportion of sudden unexpected infant deaths for all racial ethnic groups, ranging from 42 to 47%. Discrimination is defined as the treatment or consideration of, or making a distinction in favor of or against a person or thing based on the group, class, or category to which that person or thing belongs, rather than on individual merit. I know that definition's kind of long, but the part that stuck out to me the most was based on the group, class, or category to which that person belongs. There are multiple examples of discrimination when it comes to SIDS, such as cultural, racial, lower education, teen pregnancy, single mothers, and health behaviors. When referring to our case study, the Maoris were discriminated against because of their cultural beliefs. As an example of racial discrimination would be an individual saying that all Native Americans don't know how to protect their children based on the evidence that this ethnic group has the highest rates of SIDS. But they might not have been educated on SIDS, or maybe it is a cultural belief that they are not aware of. The same could go for lower education levels, teen pregnancy, single mothers, and the health behavior choices of the mother. Teen pregnancy is looked down upon in general, but evidence shows that if a younger mother is to have her child, the rate of SIDS increases, and that alone could cause her to be discriminated against.
So I'm going to talk a little bit about the social determinants of health. The social determinants of health play a contributing role on the risk for SIDS. It has also been shown that those who have lower socioeconomic status, a younger maternal mother, and limited education on parenting are also contributing factors to SIDS. Risk factors during pregnancy can play a crucial role in increasing the risk for SIDS, such as lacking prenatal care, short intervals between pregnancies, or having more than one child. When a mother drinks alcohol during pregnancy, their child is 6 to 8 times more likely to be at risk for SIDS. And infants whose mothers smoke are 3 times more at risk for SIDS. Avoiding the use of cigarettes has been estimated to decrease the chance for SIDS by 21%. It is crucial that parents are educated about the risks of SIDS and learn about the importance of refraining from substance abuse during pregnancy. When it comes to health literacy, all races are impacted, but the most impacted are the American Indians, non-Hispanic blacks, and then the Hispanics. Along with race, a lower education level and lower SES are factors that highly influence the rate of SIDS. On top of that, some of these individuals might not speak English, which can also decrease the health literacy rate. If these individuals are not able to understand or comprehend the instructions of their physicians, it will be difficult to decrease the rate of SIDS. We will go into further detail in a few slides, but the simplification of the education on SIDS drastically decreases the rate of SIDS. This is because they were able to communicate with the parents on a level that they are able to understand. Structural bias can play a role on the risk for SIDS. Factors included in structural inequities include housing, transportation, income and wealth, and health services and systems. Structural inequities limit the scope of opportunities parents have for reaching their full health potential. Structural inequities affect job hirings with both implicit and explicit biases, creating differential opportunities along with gender, racial, and physical ability divisions. Considering the populations that are affected by SIDS who have lower socioeconomic status, these individuals could have limited access to housing where there is no room for a crib. For example, a mother in a one-bedroom apartment with 4 children, or only having access to government housing, which are only located in certain areas. This housing situation can result in a transportation difficulty. If you are living in government housing and you don't have a vehicle, one has limited access to healthcare services and job opportunities. These biases can lead to the increased chance of SIDS to occur that can come from the stress of having limited transportation, housing, and health services. There is no guaranteed way to prevent SIDS, but babies can sleep more safely by following these tips. The baby needs to sleep on his or her back, keep the crib as bare as possible, have a firm mattress, and no pillows or toys with the baby. Don't overheat your baby. You can use a sleep sack, but do not cover the baby's face. Have the baby sleep in your room, but in a separate bed or bassinet for at least 6 months to a year. Also, don't use baby monitors and other commercial devices that claim to reduce the risk of SIDS. The American Academy of Pediatrics strongly discourages the use of monitors and other devices because of the ineffectiveness and safety issues. In 1992, the American Academy of Pediatrics came up with a simple acronym to help educate parents about babies and their safety. It is important to remember your ABCs. A stands for alone. It's safest if your baby sleeps in the same room as the caregiver, but not in the same bed, and it is critical to remove all unnecessary items from the crib as mentioned before. B stands for back. Always place the baby on its back. And C stands for crib. It is important that the baby sleeps separate from the parents in the crib with a firm mattress. There have been many efforts made to help overcome SIDS. The Pregnancy Risk Assessment Monitoring System, also known as PRAMS, is a surveillance protocol that collects state-specific data on maternal attitudes and their experiences before, during, and after birth, where information can be used to classify groups of mothers and infants at higher risk for health problems. A program conducted in the UK known as Back to Sleep was an educational campaign made in the late 90s. It was presented as one of the great public health success stories of the 20th century. The Back to Sleep campaign was conducted to alert the public about not letting infants sleep in the prone position, which is on their tummies. The US conducted a similar campaign called Safe to Sleep in 1994. These programs decreased the rates of SIDS drastically due to the simple delivery method along with the intertwining of partnerships with influential stakeholders. Little Lullaby began in 2009, targeting young parents to raise awareness of SIDS. This was found to be a very successful program, attracting more than 80,000 participants. The U.S. has come up with objectives and goals that they want to make improvements on through the help of Healthy People 2020. One of the objectives, for example, is to decrease the rate of SIDS by 10%. The prevalence of SIDS is decreasing each year due to programs and education provided to the public. With more implementation of resources in education, prevention, and programs presented to the public, SIDS can continually decline and more infants can live out healthy and happy lives.